We're going to now begin the afternoon sessions with an introductory address by Dr. Vijay Raghavan, who's professor at the Tata Institute of Social Sciences. Dr. Raghavan will begin our next session on spotlighting ethical dilemmas and contestations in care approaches with an introductory address. His extensive work in Tata Institute of Social Sciences and historically has involved engaging with issues of protection of legal rights and social re-entry of criminal justice clients with a special focus on women, children, and youth. And this expertise has included involvement in training of police, prison and judicial officers, both at the state and national level, on issues such as gender, human rights, prisoners' rights, correctional laws, anti-trafficking, and re-entry of crime-affected persons. Before I call Dr. Raghavan on stage, I'm going to request everyone to please maintain silence. The sessions are starting. Thank you. Appreciate everyone to please take their places and seats. Keep their mobile phones on vibrate or silent and take calls in the hallway if you need to. And now welcome Dr. Vijay Raghavan onto stage before the panel begins to give his introductory address.
Thank you, Banyan, for inviting me for this very, very interesting, important conference. I have a couple of caveats to start with. I'm actually an outsider to this whole process and yet an insider in the sense that I'm not a mental health professional. So I am a social worker who has largely worked in the spaces of corrections and criminology and then gone on to become a social work educator. My work has largely been in the area of prisons and custodial care institutions. We have come across many cases of persons with mental health issues, but we did not have the expertise to work on those cases, often had been referred, and of course, absence of services being the biggest black hole that one talks about. So from that point of view, I am the least of the experts who are sitting here. That's caveat number one. Caveat number two is I was asked to moderate this session, but I'm not sure I'm the right person to do it. So if I come across as a little less educated than all the people on the panel, please do excuse me. So with that, I'll go on to what I want to talk about today here, which Banyan, the organizers, had asked me to speak about. And I want to speak about the intersections between homelessness, mental health, and prison populations in India. So let me start with looking at who are inside our prisons. If you want to look at the profile, the socioeconomic background of people in our prisons. Firstly, just some hard data. As per the Prison Statistics India report, there are about 5.5 lakh prisoners in the country on a given date, which means that as on 31st December, that's when the prison data is counted, there are 5.5 lakh prisoners. But in a year, 18 lakh prisoners go through the prison system. So we are talking of a significantly large number of people. There are about 1,330 prisons in the country. While the official capacity is about 4.36 lakhs, the actual population is about 5.7. So we are talking of an occupancy rate of 131%. And this is the average. There are prisons in the big cities and towns where the occupancy is usually 2 to 3 times. So let me give you an example. The Arthur Road prison in Bombay or Mumbai has an official capacity of 900, but at any given point of time, you have about 2,500 to 3,500 prisoners in that. So 3 times the number of people who can be officially accommodated in a prison. The female population across the world, and particularly in India, is very low. It's about 4%, and there is a very minimal percentage of people who are trans persons. 76% are under trials, and this is a major cause of concern which keeps coming up. It keeps getting flagged at various discussions and court judgments, etc. More than 85% come from marginalized sections of society. So I mean SCs, STs, OBCs, and Muslims. This is the percentage of people who are inside who are coming from these populations. So overrepresentation of minorities is a matter of great concern. And this again is a global phenomenon, as we all know. In terms of deaths, this is the figure that we have for 2022, which is the Prison Statistics India report. 1,995 people died in prison, out of which 1,773 died due to natural causes. Now, this issue of what is natural cause is also debatable, because very often the absence of good health care can be one of the reasons why people can die of natural causes. When it comes to unnatural deaths, there were 159 deaths, out of which 119 were suicides. In terms of offense background, about 64% of people in prison come for body offenses, which means they are violent offenses. It's a matter of passion or crime, a man or a conflict between brothers or between friends, or a marital dispute, and all of these are the major cause of crimes in prison. And this is 64% among under trials and 87% amongst the convicts. That is, those who get convicted after the crime has been proved. More than around 40% are those who have been educated below class 10th. So we are talking of an education profile which is pretty difficult to look at. Now, in terms of who are the people who are landing up in prison, again, I'm looking at some of the socio-demographic factors. Large numbers, I would say, maybe 85 to 90% of people inside our prisons are coming from very poor socioeconomic background. They come from poverty families. The prison data does not talk about the income characteristics, but based on our experience of having worked in prisons for now many, many years, more than 3 decades, we can say very confidently that more than 85% would be coming from poverty backgrounds. There is existence of family conflict in many of these cases, where there is either abuse at home, or there's domestic violence, or there is issues of interpersonal violence and things of that sort. So that is another characteristic. If you talk to a person, if you've worked with a person in prison, you'll often find that these are some of the issues that they would have faced in their early life. Health issues is a very major problem, and this is both physical health and mental health that one is talking about. And when it comes to mental health, it's also the predisposition to mental health issues before they come into prison, as well as what happens to them after they come inside prison, and then things get exacerbated. A large percentage of people who come to prisons in our cities are migrants, who are first-generation migrants or second-generation migrants, who have come to the city in search of employment, essentially. They lack competent legal aid services. Our legal aid services are not as good as they should be, because we do have a system of free legal aid in our country, which is managed by the district legal services authorities. But the quality of legal aid is something that is a matter of debate. Many of them do not have residence-proof documents, identity-proof documents. Regularly, with the help of the prison administration, we organize even Aadhaar card camps inside the prison, because a large number of them don't have these documents. When it comes to women, they face double marginalization of being a minority within a population which is anyway an invisible and a neglected population. There was a study done by NIMHANS in 2021 in the COVID period, and some of the highlights from that study show that the prevalence of mental health issues ranges between 82 to 23% inside our prisons. And this data they have come by doing small studies in different parts of the country. So therefore, the variation is between 23 to 82%. And as I said earlier, there is prevalence prior to custody, during custody, and post the release phase. Some of the identified common symptoms are documented in that study. It's available online. They've also put down what are the warning signs. If someone wants to start a prevention project of suicides inside prisons, what are some of the warning signs, and how can we red flag those signs? They have put down strategies for promoting mental health, basically through awareness and communication and providing psychosocial support. They've also talked about how one can prevent suicides in prison. There is the gatekeeper model that we all talk about, that you create a cadre of gatekeepers who are peer counselors who can then help in reaching out to people who need help. And there's also a emphasis in that report on how does one handle grief and stigma, because these are some of the reasons why people end up with mental health problems when they are in prison. Now, let me come more specifically to mental health issues. What are some of the reasons that may lead to mental health problems for people who live in prisons and after they leave prisons? And this is based on our own experience of having worked in prisons for now more than 3 decades in Maharashtra and to some extent in Gujarat. So one of the things that happens to people, particularly those who come from marginalized sections of society, is the weakening of family ties because of a number of reasons. One is social stigma. The other is the issue of the distance from where the family stays to where the prison is. It costs money to come all the way. Then the environment at the Mulaqat section, where it may not be very hospitable and things of that sort, because of which, and particularly in the case of women, families often abandon them because there is the stigma of a woman having committed a crime. We clearly see a link between homelessness and mental health issues, because in prison you'll have largely 2 groups: people who have family support and people who don't. And those who don't have family support, they might end up being homeless after release. And sometimes they come in as homeless populations when they come inside. There are worries about their case, and especially if you don't have a good lawyer. So that can be eating you up from inside. When it comes to women particularly, there's the issue of their children left outside. And they're very, very worried about what's happening to those children. There is a background of having faced violence and trauma in their lives. So that definitely can be an additive factor when we are talking about mental health issues. There is also the issue of stress related to crime commission. You see, a lot of us think that, people who commit crimes are, probably, they've voluntarily done it and things of that sort. But a large number of people who commit crimes are forced into certain situations and circumstances. And then, like in Hindi, they often say, when you talk to them, mere haath se ho gaya. So there is a certain kind of passivity to it. It's not as if they're saying, maine kiya. It often says, mere haath se ho gaya. So that itself indicates that it happened to me, not that I did it. So that there are a lot of stresses related to the whole issue of commission of crime. Then I would like to highlight the issue of the indignities that are heaped to people when they are inside. Right from the time of the strip search, where the manner in which the strip search is done. At every point, from the time of arrest, the first thing you will notice is, especially if you come from a poor family background, the police will ask you to remove your chappals. So you will walk into court without footwear. And that is a way of dehumanization of the person and to, for example, show them their place. And often you hear things like, tere baap ka ghar nahi hai ye, which means this is not your father's house, this is prison, this is lockup, so you better behave yourself. So there's a constant reiteration by the authorities to show them their place. And this is one tactic by which they maintain discipline inside the custody. Because we must also remember that custodial care institutions are terribly understaffed and the staff is overworked. They don't have leave. They work for 14 hours a day. So that's a different story altogether. But that has an impact when it comes to how they treat people who come inside. The last but not the least is the issue of legal aid. The inability to get bail, delays in trials. All of this becomes an ideal kind of a pot boiler to create a spectrum of mental health issues and problems. One more thing I want to add here is, in the course of dealing with adversity, many of them become very resilient. But that same resilience also leads them to become rigid and difficult people to deal with. because they have faced certain experiences in their lives and they have found a way to deal with it, but that very quality makes them difficult to deal with as people when you work with them, especially in the post-release phase that one talks about. There are also feelings of lack of faith, fatalism, guilt, shame, and anti-system values. And once they get released, as the issue of social stigma and social isolation. I'm not going to go into this. There are a number of issues relating to staff, absence of inadequacy of staff, absence of correctional staff. You don't have social workers and counselors in the prisons, which is absolutely basic if one is to do any kind of correctional work within the system. There is mental fatigue faced by the staff. Many times they tell us, you do so much work with prisoners, do some work with us, and that's absolutely right. Prisons are largely seen as places of punishment, and prisoners are seen as people who are either lazy, cunning, or evil. That there could be a relationship between marginalization, crime, and mental health is something that often gets lost in the larger narratives that we talk about. I don't have time, but just to briefly tell you, many cases that we have dealt with over the years, a woman who came into prison because she did not pay the taxi fare. She was a mentally disturbed woman who took a cab, roamed the city of Mumbai, and finally said, I have no money to pay. So it ended up in a police case, and she ended up in prison. Should she have ended up in prison for not having paid a taxi fare? It was very cases of women who are arrested for kidnapping of children. Actually, they are walking on the streets, a mentally ill woman who her children are not with her. She picks up a child and just picks her up, and there's a huge hula-bula about it, and she ends up in prison. Female infanticide cases, many women whom we have worked with. Men who have anger outbursts, and because of that, there are cases. So many cases that one has dealt with over the years. I think I'll stop here because time is short. But the broad point that I want to make is that we really need to look at this area which is completely invisibilized within the larger narrative of mental health initiatives in our country. Prisons and custodial institutions. I would also add women's shelter homes. I would include beggars' homes. I would include children's institutions. All these are places where there is an undiagnosed situation of people who are at different levels of mental health breakdowns, and they are dealing with it by as much as they can, and the staff is dealing with it as much as they can, but there is no systematic approach to look at what can be done in this situation. Thank you.
Thank you, Dr. Raghavan. Really appreciate that for taking us through the determinants, social and structural, all the factors leading ultimately to incarceration and confinement, and then the historical and new factors that then result in mental health illness. And we can talk more about kind of this, like you mentioned, the invisible and ultra-vulnerable population.